Did you know about 1 in 2 women and 1 in 3 men will develop cancer at some point during their lifetime? How common is cancer? Cancer is the second most common cause of death worldwide. Researchers estimate that in 2024, over 2 million people living in the US received a cancer diagnosis, and over 611,000 people resulted into death due to the disease. However, this is due to failure to note the early warning signs. In this video, we reveal 6 early signs of cancer that you should never ignore, because recognizing them early could save your life. Stay tuned to find out what warning signs you need to pay attention to before it's too late. Before we dive in, please subscribe to our channel for more informative videos. Now back to the topic. Number 1. Fatigue, extreme tiredness or weakness. We all experience fatigue from time to time, whether it's due to a busy schedule, stress, or lack of sleep. However, if you find yourself feeling unusually tired, weak, or drained despite getting plenty of rest, it could be a warning sign of something more serious, including cancer. Fatigue is one of the most common and subtle symptoms of cancer, and it can affect nearly every aspect of a person's life, making it difficult to concentrate, complete everyday tasks, or simply get out of bed. Cancer-related fatigue is different from the tiredness we feel after a long day or an exhausting week. It doesn't improve with sleep or rest and can often worsen over time. This extreme exhaustion can be caused by the body's response to the cancer itself, or due to the side effects of treatments such as chemotherapy. For cancers that affect the blood, like leukemia, fatigue can also be linked to a decrease in the number of red blood cells, which can result in anemia and a feeling of constant tiredness. If your fatigue is persistent, unexplained, and is affecting your ability to go about your day-to-day life, it's time to speak with a doctor. Along with fatigue, you might notice other symptoms such as weight loss, unexplained pain, or changes in appetite. Early detection of the cause of your fatigue can lead to more effective treatment options, so don't wait to get it checked out. Number 2. Change in bowel habits, persistent diarrhea, or constipation. Most of us experience occasional changes in our bowel habits, whether it's from a change in diet, stress, or a short-term illness. However, when these changes become persistent, severe, or are accompanied by other symptoms, it could be a warning sign of cancer. Colon cancer, for example, is known to cause significant alterations in bowel habits, including persistent diarrhea or constipation. You may also notice a feeling of incomplete evacuation or blood in the stool. When cancer develops in the colon, rectum, or digestive tract, it can disrupt the normal functioning of the bowel, leading to irregular or unusual bowel movements. These changes could include alternating between diarrhea and constipation, a sudden urgency to have bowel movements, or difficulty passing stools. Additionally, if you notice that the shape of your stool has changed, such as becoming narrower or resembling pencil-thin lines, it's crucial to seek medical attention. Any significant change in bowel habits that lasts for more than a couple of weeks should be evaluated by a healthcare provider. Early detection of colorectal cancer can lead to highly effective treatment options, including surgery or chemotherapy, so it's important to catch the problem as soon as possible. If your symptoms are accompanied by blood in the stool, abdominal discomfort, or unexplained weight loss, seek medical attention immediately. These could be signs of a more serious condition that requires prompt diagnosis and treatment. Number 3. Unusual bleeding, unexpected bleeding in the body. Unexplained or unusual bleeding can be a red flag for several types of cancer. While many of us are familiar with the occasional nosebleed or minor cuts, if you experience bleeding that doesn't seem to have an obvious cause, or if the bleeding persists, it's important to pay attention. Cancer can lead to internal bleeding or unusual blood flow, depending on where the cancer is located. For example, bleeding from the rectum, coughing up blood, or abnormal vaginal bleeding can all signal serious conditions, including cancer. One of the most common cancers associated with unusual bleeding is colorectal cancer. If you notice blood in your stool or when you wipe, it could be an early sign of colorectal cancer or a related condition, like hemorrhoids. However, don't assume that bleeding is always harmless. Cancer in the stomach, esophagus, or liver can also cause internal bleeding, leading to symptoms like black, tarry stools, or vomiting blood. In women, abnormal vaginal bleeding or spotting between periods can sometimes be a sign of uterine, cervical, or ovarian cancer. Similarly, if you experience unusual bleeding from the nose or gums that doesn't seem to stop, it could indicate a blood cancer, like leukemia. If you notice any unexplained bleeding, whether it's from your gastrointestinal tract, in your urine, or from unusual sources like the nose or gums, it's crucial to see a doctor right away. Don't wait to see if it stops on its own. Prompt medical attention could lead to early diagnosis and more successful treatment options. Number 4, skin changes, new growths, moles, or discoloration. Our skin is often a reflection of our overall health, and while minor changes like dry patches or temporary rashes are typically harmless, certain skin changes can be a cause for concern. New growths, moles, or any changes in existing skin spots could be an early warning sign of skin cancer, which includes melanoma, basal cell carcinoma, and squamous cell carcinoma. One of the most common signs of skin cancer is a new mole or growth that appears suddenly or changes in appearance over time. If a mole becomes irregular in shape, changes color, itches, bleeds, or starts to crust, it could be a sign of melanoma. The ABCDE rule is a helpful guideline for identifying concerning moles. Asymmetry, border irregularity, color changes, diameter greater than 6 millimeters, and evolving shape or size. If your mole fits any of these criteria, it's essential to get it checked by a dermatologist. Similarly, existing moles or spots that suddenly change in texture, become painful, or start to bleed should not be ignored. Even if the changes seem minor, they could be an indication that cancer is present. Early detection of skin cancer is crucial for successful treatment, as it is highly treatable in its early stages, especially melanoma. If you notice any of these skin changes, don't wait. The sooner you get a skin check, the sooner potential issues can be addressed. A dermatologist can perform a thorough examination and may take a biopsy of any suspicious growths for testing. Number 5, a sore that does not heal, unhealing ulcers or lesions. Most of us encounter minor cuts, scrapes, or sores that heal within a few days or weeks. However, if a sore or wound refuses to heal, it could be a sign of a more serious underlying condition, including cancer. Non-healing sores or ulcers are often associated with skin cancers, oral cancers, or cancers affecting the lymphatic system. When a sore lingers for weeks or months, it's important not to dismiss it as a minor issue. In the case of skin cancer, particularly squamous cell carcinoma or melanoma, a wound or sore may persist and fail to heal despite usual care. These sores may appear on areas of the skin that have been exposed to the sun, such as the face, arms, or neck, and they may become increasingly painful or show signs of infection. A sore that bleeds frequently or has irregular edges should be evaluated by a healthcare provider. Similarly, in oral cancers, ulcers or sores that develop in the mouth and refuse to heal could indicate the presence of a tumor in the gums, tongue, or inner cheeks. If you have a mouth sore that lasts longer than 2 weeks, is painful, or makes it difficult to eat or swallow, it's time to seek medical attention. Unhealed sores or lesions, especially if they are accompanied by other symptoms like unusual bleeding, pain, or changes in the appearance of the skin or tissue, should never be ignored. Seeking early medical advice can lead to better outcomes and help prevent the progression of more serious conditions, including cancer. Number 6, Indigestion and heartburn, persistent digestive issues. Indigestion and heartburn are common problems that many people experience after eating a large meal, consuming spicy foods, or due to stress. However, when these digestive issues become persistent or worsen over time, they could be a sign of something more serious, including cancer. Chronic indigestion, heartburn, or acid reflux can be linked to cancers of the digestive system, such as esophageal, stomach, or pancreatic cancer. For instance, persistent acid reflux or gastroesophageal reflux disease, GERD, is a known risk factor for esophageal cancer. GERD can lead to the backflow of stomach acid into the esophagus, which over time may cause irritation and cellular changes that increase the risk of cancer. If you experience frequent heartburn or indigestion that doesn't improve with medication, or if these symptoms are accompanied by difficulty swallowing, weight loss, or abdominal pain, it's important to see a doctor. In some cases, stomach cancer or pancreatic cancer may also present with symptoms such as bloating, early satiety, feeling full quickly after eating, or a change in bowel habits. If these digestive issues are severe, persistent, or are accompanied by other alarming symptoms, it's crucial to get them checked out by a healthcare professional. Chronic indigestion or heartburn that persists for more than a few weeks should not be ignored, as early detection of digestive cancers is key to improving treatment outcomes. A doctor may recommend further testing, such as endoscopy or imaging, to diagnose the cause of your symptoms and ensure that any potential cancer is identified early. Your health is your most valuable asset. Don't wait for symptoms to worsen before you take action. If you notice any of these signs, make sure to see a healthcare professional right away. Early detection can make all the difference in the fight against cancer. If this video has been helpful, share it with your loved ones so they can stay informed too. Don't forget to like, comment, and subscribe for more life-saving health tips. Stay proactive about your health, because prevention is always better than cure.